Good morning, and thank you so much for joining us for SBB University. I am the publisher of Seniors Blue Book, and I will be your moderator today. Absolutely delighted to bring on four of my very special partners in crime. We have Mr. John Hoagland, who's here with us from Hoagland Family Hearing and Audiology. Dr. Stephanie Fields, who's with us from Sunshine State Podiatry. We have Dr. Reed, who's with us from physical therapy. And we have Chris Williams, who is with us from Emeritus Health, aka Balance University Extraordinaires. So excited to have all of my expert panelists here today to talk to us about balance. We have a wide variety of topics that we're going to be covering. Why don't each of you tell us a little about yourself and your background? We'll start with you, John. I know you've been doing this for a very long time, so tell us a little bit about yourself.
So I have been in the hearing healthcare field for 36 years now. My wife and I were 14-year Bradenton residents before coming here. And we have, in 2003, we had our first audiology center, Hoagland Family Hearing and Audiology, in Bonita Springs. And we have since opened in Estero. We are by Gulf Coast Hospital in Fort Myers. And we also have an office in Cape Coral. And we deal with not only hearing loss, but tinnitus or ringing ears as well.
Perfect. Thank you. All right, Dr. Fields.
I'm Dr. Stephanie Fields. I have a small podiatry practice based here in Southwest Florida. We have an office in Bonita Springs. We also do a lot of house calls. We do house calls. I did a house call this morning up in Fort Myers. And then we'll do them all the way down to Marco Island. We work with a lot of insurance. We also have a competitive cash pay system. And we treat everything. We have privileges at Naples Community Hospital. We do surgery. We work with a lot of diabetics. My husband is trained in wound care. He completed a fellowship, so we deal with a lot of wounds, and we have a large range to our practice. And here's a model of a foot.
All right. And Dr. Virginia Reed, thank you so much for joining us. Tell us a little bit about yourself and your background.
Thank you. Thank you. Happy to be here. I am Virginia Reed. I hail from Arkansas. And so if you pick up a little bit of an accent, that's why. I got my doctorate in physical therapy in 2004 at Shenandoah University in Virginia, and then came down to sunny Fort Myers to start practicing. I have been with the same company for the last 16 years. It was Florida Fitness and Rehab, and then became physical. And absolutely love it. With physical, we try to treat the whole person. And so we have multiple disciplines within us, but I'm as part of the physical therapy department, and also specialize in vestibular disorders. I have since 2006, and it's my passion.
Fantastic. Thank you so much. And last but certainly not least, we have Mr. Chris Williams, who's with us today. Chris, tell us a little bit about your background.
Sure. Hello, everyone. My name is Chris Williams. My education is actually in dietetics. And so I moved here to Southwest Florida in 2005 and met Dr. Obador Khan and was working with him and some of his patients. And I noticed right away we were having some issues with falling. And as I did some research and found out the statistics and just how great of a problem this is and how many issues stem from unintended falls, I began to research and decided to write my own balance program along with Dr. Khan and some other physical therapists and occupational therapists. And after about 3 years, we self-published Balance University in 2018, and we're actually on the second version now. You can see it here, which is same program, just a lot more beneficial information, a lot more resources in the program, in the book itself. We offer classes in person and, of course, online classes now that we have battled COVID and all of us have adjusted. We did as well. We have online classes. I also teach Balance University for the FGCU Academy, formerly known as the Renaissance Academy. And then I work one-on-one with clients who may have specific issues or challenges. We go into the homes and address those issues so that they can get to a point where maybe if they want to participate in the classes, in the balance classes, that they can do that.
Perfect. Thank you so much, Chris. All right, we're going to get started with today's program. I'm going to kick it off with John. You give a very interesting minimized version of this lecture on untreated hearing loss and whether it's your memory or your untreated hearing loss. That talk to us a little bit about the connection between untreated hearing loss and balance.
Certainly. The untreated hearing loss has been studied in great deal, and we hear with our brains, not our ears. The electric impulses that come through your cochlea, which is a network of 26,000 nerves, send electric impulses up to the brain. When the flow of electricity stops due to hearing loss, the Pennsylvania School of Medicine found brain atrophy begins to set in that processing center. And the first effect is years later, you can get sound to the brain, but the brain can't turn it into language. So that's the person you see who says, I hear things louder with my hearing aids, but I don't understand them. Typically, that means we may have started too late in the curve. Well, Johns Hopkins found brain shrinkage. And the only other place we'd ever seen brain shrinkage was in the dementia and Alzheimer's field. And that's when Johns Hopkins research launched some staggering statistics that said mild untreated hearing loss actually doubles the risk of memory loss, dementia, and Alzheimer's. Moderate, making it a 3 times multiplier, and severe, making it a 5 times multiplier. And that is untreated. If we wear hearing aids and we send the electricity to the brain that it needs, it seems to mitigate some of this. And in this, they found what is called cognitive load. So our brains only have so much they can do simultaneously. When we are really focusing on trying to figure out what someone's saying and watching their lips, etc., well, that absorbs a lot of this cognitive load. And one of the things that's at the expense is memory. I'm just trying to flow with the conversation. Oh, what was your name? Where did you say you were from? Those things get lost in the distance. Well, it turns out the balance system requires a lot of cognitive load. And so because of that, Dr. Lin also stated that mild untreated hearing loss makes it 3 times as likely to suffer a fall, moderate 6 times multiplier, and severe untreated hearing loss, meaning not wearing hearing aids, makes it 9 times as likely to suffer a fall. So when people think about their hearing, far too often they think of it more just from the nuisance, annoyance, frustration, embarrassment. It's annoying the television's louder than my family would like it. It's frustrating if I miss the punchline of a joke. It's embarrassing if I've answered someone inappropriately. But very few people fully understand all the medically beneficial or medically necessary side of clear data, information, electricity reaching the brain.
You couldn't be more correct on that. And I'm speaking from experience with my grandparents. Try to explain that to them. Now, just quickly tell us, how has COVID impacted this? Because I know with people, just for example, with falls, people wearing their masks or tripping over curbs and stuff because they really can't see over it. But there's so much more to it, especially with impacting your industry. So talk to us a little bit about how COVID has affected those with hearing loss.
It's been in several ways. From the cognitive perspective, isolation has not been good for anyone. We need social interaction. We are social creatures by nature. And if someone is having any cognitive functions, the last thing you want them to be is socially isolated. So people with broken hearing aids, I have tried to do everything to reach out to the community and say, if you can get hearing aids to me, even if you can't come in yourself, I'll fix them for you. I'll do manufacturer's warranties, et cetera, so that we can get these working back again. But people rely on visual clues, and masks going over someone's face take away those visual clues, and it makes it much more challenging for people to communicate. Masks have sent hearing aids flying because they catch the mask and go zipping off, and people can lose them. So there are masks, there's 2 types. There's the type that we're all familiar with that fit over the ears, but then there's the type that fit over your head. And they have a strap that goes lower and then a strap that goes over the top. So nothing is pulling on the ears to send them flying. In addition to that, because of isolation, we found a way to remotely program hearing instruments. So people who don't feel comfortable physically coming in, we could be sitting in our office, they could be sitting in their home, and we can fine tune and adjust the hearing aids. And on the lost hearing aid end, those who have made for iPhone hearing aids now have a Find My Hearing Aid feature. And you click that and it will give you the GPS location of the hearing aid. Let's say, oh, it fell off at Walgreens. And as you walk around Walgreens, it has a hot, warm, and cold button until you find it. And a big one now is that people are spending so much time on TV. And TV sometimes isn't the best because the speakers are at the back, they come off the back wall. And so now there are TV streaming devices that go directly from the hearing aids from the television box into the patient's ear. And the other family member who's being blasted out actually can now control the volume themselves.
Technology has come so far. Isn't that crazy how far technology is really amazing?
It's not even the same field I entered 35 years ago.
Definitely not. All right, well, we'll bounce down to Chris. Chris, talk to us about some of the things that we can do to prepare for or strengthen our balance. And then we're kind of move through, and we'll do Dr. Reed next and talk about some of the things that you can do after an injury if you do suffer a fall. So Chris, talk to us about like maybe prevention and what you do.
Sure. So in my best New Jersey draw, that's where I'm from. Not really. I'm from Texas, but I like to throw people off. But, you know, as you can see, balance is a pretty simple issue. Dr. Haglund explained that, and that's also a joke as well. So it's complex. And so you have the vestibular system, you have cognitive issues, you've got the ears and the eyes that sometimes send mixed signals. That's when we get motion sickness. So I let the professionals deal with that. My job is to make sure that the body is strengthened, that our muscles are functioning through their full range of motion that they're responsible for. So we have a full gait pattern. Our posture is correct so that our center of balance, our center of mass is not thrown off. And so we do this by addressing strength, posture, flexibility, and then of course, those balance issues. So those receptors at the bottom of your feet that detect pressure, if you're too far forward, too far back, left or right, they're sending the signals to your brain, and you have what we call neuromuscular efficiency. It's how our brain, it's a big fancy word to say how our brain communicates with our muscles so that it is efficient in order for us to keep us erect. And in classes, that's what we do. We make sure first and foremost, the legs are strong. Red flag. I walk into a home where I see someone that can't stand for 30 seconds. That's a red flag. Even why do we walk on a treadmill? You have to have strong legs to walk on a treadmill. We walk on a treadmill because we love it, right? No, because we want to strengthen our heart. It's what we call, it's actually in the name. We're doing cardiovascular training. But if your legs are not strong enough to even stand for 30 seconds, it's going to make it really difficult to keep yourself from having an unintended fall.
No, you couldn't be more right about that. And one of the questions that I was going to ask you is, why is your legs a life indicator? And that may be exactly what you were just going over. Now, what are some simple exercises that you can do around the house while you're cooking dinner for your wife even to keep your legs strong?
I know where you're going with that. So I always tell in our lectures, when we do our lectures at Florida Blue or Fort Myers Beach Library or wherever we may be, I always look at the guys in particular and I say, listen, gentlemen, when you're cooking dinner for your wives, right, or your spouses, and you're standing in the kitchen and you're watching the microwave count down, some simple things you can do is grab a chair, right, and you can stand next to a counter. We want to be safe, we want to be confident, right? We don't want to put anybody in danger, but you can take the counter and you can just simply take your leg and do what we call a lateral leg lift, right? And what this is going to do is it's actually, a lot of folks think that you're going to feel a lot of that stress in the leg that you're moving. But really what's happening is the leg that's stationary on the ground is having to counteract all that motion laterally coming back in as you abduct and adduct. And a lot of people are very surprised that not only are we strengthening the hip, right, in that leg that's moving, but a lot of the work, and I think a lot of people are shocked at just how much work is being done in the leg that's stationary. In fact, in class, we'll see a lot of people kind of look around and shake their leg. And so we're strengthening that lower leg.
No, I love the presentation that you give, because it's always kind of a joke. The women are like, oh yeah, they're cooking me dinner. But then you say in the microwave.
Yeah.
All right. Dr. Reed, what are some things that you see, some injuries that you see most common in your field that bring people in with falls?
Like Chris said, certainly orthopedic issues, people with back issues that can't stand erect, throws their center of gravity off, okay? People with hearing loss usually have vestibular issues as well, which means their inner ear's not telling their brain correctly where they are in space, so they have to overuse their eyes. Like Stacy will talk about, your feet are a big problem. Basically anywhere on your body. The way I kind of like to explain things when balance is concerned, because vestibular disorders and balance are my specialty. Basically, when someone comes into us, we need to do a full-on orthopedic and vestibular assessment, because you have to look at the whole body. You have to look at the person as a whole. But the way balance is kept is you have 3 sensory systems that tell your brain where you are in space. That's your vision. Are you upright with the horizon? Your inner ear, where is your head in space? And then the receptors Chris was talking about in your feet, your proprioceptors, to tell you if you're on an incline, decline, uneven surface, even surface. They send that signal to the brain. They all work together to send the signal to the brain. Brain processes, shoots the signal down to the legs to counteract with your balance strategies, with your ankles and your hips and stepping. So when there's a kink in the system, whether it's processing due to dementia or cognitive problems, whether it's sensory due to hearing loss or dizziness, the inner ear is very complex. Like John was talking about, there's the cochlea, but there's also the balance center in the inner ear and the vestibule, and the common nerve comes in from the brain and then separates, and one goes to the cochlea and one goes to your balance center. So you can have hearing loss with no balance problem, or you can have balance problems with no hearing loss, or you can have both because it affected the common nerve, okay? So what we have to do is figure that out through audiology, like John says, and VNGs, through our infrared goggle system with physical therapy and determining the dizziness, and then also looking at the orthopedic system, because the motor system is part of that correction process. So wherever there's a kink, we have to try to correct. And that's
kind of leading into the next question I had for you, is how do you work with other specialties to ensure that someone's prepared for the aging process? Because it's not just physical therapy that you guys do. And also talk to us about whether or not you need a prescription to get these services.
So basically, a lot comes down to education. If we can educate the patient about what we see that's going on with the full body, not just the part they came in. Let's say someone has a shoulder injury, but it's because they fell, because they tried to get up to go to the bathroom real quickly because they had incontinence, and they fell because they were dizzy. And so you have to really look at the whole person, and that's what physical does. And so we work with other specialists as far as physicians go, neurologists, ear, nose, and throat doctors, orthopedic physicians, to take care of some of those things. But then we also look at audiology, and we also look at prevention, kind of like Chris said. At Physical, we do have a wellness part of our company that is designed to help with the older population. It's more designed for 55 and older, although other age groups do come. But our specialty programs are things like rock steady boxing for Parkinson's disease, balance and vestibular training to get the sensory and the motor for those that are at high risk for falls, fighting chronic disease, those with degenerative conditions, MS, rheumatoid arthritis, that still need help functioning and exercise, but you have to do it on a lower impact level. Or cognitive, we just added that one. No one likes to jump into a cognitive 101 class, but when they understand it, it's keeping your brain as healthy as your muscles. And so while you're doing exercises with your muscles, you're asked to do a math problem, and that's how many squats you do, or you're asked to combine both brain activity with your muscle activity. So you're working your entire body and you don't start, succumbing to dementia and different things like that because your brain's not active. So we work with in-house disciplines like pelvic health and audiology and wellness, but we work with other physicians as well. And do you need a referral to be here? If you're Medicare, you do.
Yeah.
We take all insurances. Medicare does require physician referral, which we could help you get. Other insurances, if you're like Blue Cross and Blue Shield, that's not a Medicare replacement, or Cigna or Aetna or something like that, you can come straight off the street for 30 days. Florida law says after 30 days that we have to have a physician on record for you, which we could always talk to your physician for you and help out with that. But we have to communicate. We get to see people for 40 minutes, 3 days a week. The physician sees them for 5 minutes once a month or once every 6 months. And so we're going to catch things more often than they will. And so it's up to us to report back to the physician and work together to make sure that person is treated the right way.
Perfect. Perfect. Good to know. I didn't realize that if you didn't have Medicare, you didn't need a referral for the first 30 days. So I learned something new every time I do these. Yeah, for sure. All right, Dr. Stephanie Fields, thank you so much for joining us and for your patience. You cover everything foot and ankle related. Talk to me about a couple of things. The orthopedics. A lot of folks are looking into orthopedics and they may just go buy something at CVS or Walgreens. Talk to us about why a professional orthopedic might be the better way to go.
Okay. So orthotics. So I have a couple examples of different orthotics here. So in the ancient times, these metal orthotics, these are from World War II. So they're hard. I don't know if you can hear them. They're really uncomfortable. These are the original. They're arch supports. They will support your arch. Most people have flat feet or they have normal arches and they're walking around all day. So they would benefit from an orthotic. We don't do these anymore because they're uncomfortable. So we do these. These are very comfortable. They have a nice top cover, everything's good. They don't bend. So the ones that people buy at CVS, those Dr. Scholl's ones that are $12, they bend in half. So there's no support there. So that's the problem with them. Some people say, like, if you can take your 2 fingers and push them down and it doesn't bend, that's a good orthotic. So that's just something to look for when you're looking for orthotics. Orthotics generally are around $40. If you're paying hundreds of dollars for orthotics,
Sorry, that was my fault.
Oh. Only for me, for the best for last, right? So anyway, what are you gonna do? So with this, with an orthotic, for cutting that one that's not custom molded, you should be looking around $40 or $50. If you're paying hundreds of dollars for something that's not custom molded, you're not in the right place. Custom molded orthotics start generally around $300 or so, and those are for people that have different deformities. They might have like severe flat foot where this bone here is all the way down in the floor and they need that orthotic or something like that. Now, the other type of orthotic, this is a plastizote. This is for a diabetic. These are very soft and they prevent wounds and things like that. So they are very good. I recommend all diabetics get a pair. So most of them are covered by insurance, but it just really depends. I sell them here for around $20 to $30. They're pretty cheap. I also will do plastizote for people that are have severe deformities like rocker bottom sort of feet where the bottom has completely gone out. I've done plastizote for them, or people that have like Charcot foot, which is a severe, basically a diabetic sort of thing. So if you have it out there and you're watching this video, come to me.
Yeah, definitely. And while you're on the topic of diabetics, talk to us about why it's so important for a diabetic to come and see a podiatrist.
So either I'm in the hospital and I get called, I'll get called for somebody with an infection, and they'll have their foot is in really bad shape and we have to do an amputation, and they're like, well, I didn't know I was diabetic. So I either meet them, that's where I meet people when they're finding out they're a diabetic and they're in a dire situation. So I hate that. That's the worst thing for me. I'd rather people go to their doctor regularly, get checked. And so when they come to me, I can do preventative care. I can prevent amputations. I can look and see if you have hammer toes, or, so a hammer toe is like where the toe would like buckle, sort of like this. I'm sure you're familiar with them at home. I can look at all these deformities. I can adjust so you don't develop wounds, so we don't get into these kind of situations where I have to do an amputation, because that's the last thing I want to do.
Yeah, definitely, because that can most certainly affect your balance.
Yes.
Absolutely. Okay, we have time for one more round of questions. John, I think one of the questions I wanted to ask you specifically was during COVID, some folks have gotten their tinnitus has gotten even worse. So what is your advice for people that say that their tinnitus or the ringing in their ears has gotten worse since COVID started?
There are three legs of a tinnitus stool. And tinnitus, for those who aren't aware, is pronounced tinnitus in the clinical community, tinnitus typically in the patient community, but it's any sort of head noise. Now, one thing for certain, if it's only in one ear and you have no earthly idea why that is, please give us a call. There could be something more serious going on. If you can't tell, it's in both ears. But there's the sound itself, and people hear a ring, a rushing sound. Some hear crickets, bumblebees, etc. All of that is tinnitus or tinnitus. There's the sound itself. There's how much that sound draws our attention and how much stress or distress that brings to our life. And you really have to focus on all three components. So we've never been in a more stressful time. People are worried about their health, their family members' health, their careers, their family members' careers. You throw in the political discourse, the maskers and the non-maskers, all the other tensions out there. The stress hormone cortisol is like kerosene on a fire for a tinnitus patient. So it is now, there's now more calls to the American Tinnitus Hotline and their suicide hotline. There were more from March 1st till December 31st than there had been in the 5 years combined before that. So keeping your stress levels down is critical. Doing things, people used to stay active. They would do things and have hobbies and try to keep themselves busy. Well, now we're quarantined. And then you're watching television and all it is bad news. And so the stress keeps rising. And if anybody is in the throes of a, let's say, distress or even meltdown because of this, please reach out to us. If you can't come in, I'll do some telemedicine style approach. I'll help you through it. I'll coach you through it, and we'll get some steps in place to try to help. There are treatments that can help people with tinnitus. When I opened my office in Estero, I actually called it Southwest Florida Tinnitus and Hearing Center. And I put tinnitus first to let people know there's hope. Because too often the message has been, suck it up, buttercup, you're stuck with this for life, and no one will ever be smart enough to give you a smidge of help and hope, and it's going to get a lot worse. Get ready. Have a nice day, pay on your way out. And I thought that's a horrible message. So we want to offer a message of hope to people. When you were talking about diabetes, all these things interact and have comorbidities. Diabetics are twice as likely to have hearing loss as non-diabetics. Diabetics are more likely to suffer falls because of the peripheral neuropathy and not feeling your feet, etc. So all of these with the sound mind and the sound body are all interrelated. And one of the things I stress to everybody is have somewhere in your records a baseline hearing test, not unlike a baseline PSA for a male or a baseline mammogram for a female. It's one of the baselines we really stress with people, and we do it on a complimentary basis. We never wanted expense to be a barrier to knowledge, so we do this testing completely free of charge, and we'll furnish you with a dated copy for your records. If you're finding some cognitive issues, we'll send one for your neurologist for you. If you're finding things with diabetic issues, we'll send one to your endocrinologist. If you find that we're having balance issue, we have great referral sources as well, and there's great resources on this panel to help you with those things. But always know where you stand. You know, it tears me up to hear a podiatrist say the first time someone finds out they're diabetic is when they're to the point of amputation.
Yeah.
I mean, monitor your body and do things. And, you know, if you get to Chris before you start having falls, you're a lot better off than getting to physical therapy once you're healing from damage. You know, I think we're becoming a more health conscious nation, but we should stay on top of these things. And if there's any spinning vertigo, that could be a condition of the inner ear. You know, if you're moving and you start to see a sensation, talk to somebody about it. Just don't stand there until it stabilizes and go about your day. You know, a lot of these things can be addressed and helped, but, you know, an ounce of prevention is really worth a pound of cure. And getting early intervention, I think, in each and every one of our fields is so critical to the long-term outcome and the well-being of the patient.
It really is. And getting that baseline is so important because you have nothing to compare it to if you don't start while your hearing is good. So that's fantastic advice. So Chris, I'm going to move
above. And the last thing, from 50 and above, every 5 years on a hearing test. So if you haven't had one in the last 5 years and you are over 50, get one and we'll give you a copy of it, but you want to monitor it, please.
Perfect. Thank you, John. Thank you so much. All right.
Can I just comment on Dr. Hogland's, what he was just saying is, in the weight loss world, I've read reports that people who are in groups, who have a support system, family, friends, group fitness, they're 60 to 70% more likely to succeed their target goal, their target weight loss goal, than trying to go it alone. So there is power in numbers.
Sure. Yeah, definitely. And your question was really going to be about the importance of exercise and paying attention to your balance as you age. Talk to us about why it's so important. It's important at all ages, but why it's so important really after you get to that age group of like 60 plus.
Sure. So one of the things we do, we offer a free assessment, a free orientation where we come in with a stack of papers and we get a brief medical history, but we go through a couple of different assessments, both physical and mental. And one of the assessments is the Romberg test. And it's a very simple test for somebody like me to do to detect the early stages of a neurological disease, like maybe dementia, Alzheimer's, that might be out of my realm that I refer to one of the doctors here on the panel. As you age, of course, men, we start to lose testosterone at the age of 30. And then cognitively, our synapses in our brains begin to separate, they get further apart. We move less, we're less mobile, thanks to these things. Right. So now when you have to go tell John or Sally that there's a meeting, you're not getting up and actually taking those extra steps. You're just texting them or shooting an email. So all those little extra movements that you lose during the day play a huge impact. And you can see that as another pandemic, obesity has been a pandemic for quite some time, you know, and has been classified as such. And so as we age and we get to that 60, really 70-year-old age, I read reports that say that once we hit 70, what we have at that point is what we will take with us as we move forward through the aging process. It becomes really difficult to build lean muscle tissue to gain real muscle strength afterwards. Now, it's not impossible. It's absolutely not impossible, but it certainly takes a great deal of discipline to do so. And with our balance classes that we meet once a week, you take your homework with you. If you perform just 1%, there's 10,080 minutes in a week. All I'm asking for is 2 hours, right? That's it. If you can do that and you can do that consistently, you're going to start to see the impacts on the physical side. We still have the vestibular system and these other issues to address, but at least physically, you have done your homework.
Perfect. Thank you, Chris. That's a great wrap up. All right, Dr. Reed, just going to ask you to kind of go over some closing remarks. Your questions that I have pre-designed for you, some of them aren't necessarily as applicable to our discussion today, so I apologize for that. What closing remarks do you have regarding balance?
It's comprehensive and there's help, basically. Everyone on this panel has made very, very good and smart remarks because it is very complex and it is, every system is involved with your balance. One thing I didn't mention before when I was talking about the referral is if you think whether you're Medicare or not Medicare, if you think you might have a balance problem or you just feel like you need an assessment or you want to find out if there's some kink in your system in any of those areas I talked about, we have what's called a physical first appointment, and you can come in and speak with one of the doctors of physical therapy for usually about 20 minutes or so and tell them what's going on with your body, what you've noticed, and we can help guide you on whether physical therapy is the right place for you or whether a wellness program is the right place for you or whether you need more intervention from a physician. And so we can help guide that. There is help out there. You don't have to know what's happening to you. You just have to be able to take the steps to speak with someone who could help you find out.
Perfect. Thank you so much. And Dr. Fields, any closing remarks regarding podiatry and balance?
I mean, for balance for us, I mean, there's a lot of different things. When people come in, we do like a biomechanical evaluation. We check if there's a limb length discrepancy, if there's been like a history of falls, you know, there's a lot of different things we can look at to see. It just really depends. I mean, in terms of balance, I mean, you know, we deal with a lot of elderly that have falls and things like that, and it can be pretty difficult to manage. Do they, and you know, it's also, do I need to refer them for physical therapy? I've referred to physical before. You know, do I need to send them to an orthopedic doctor? Is their hip bothering them? Do I need to send them for custom molded shoes? You know, do they need a heel lift on their shoes? Is their limb length that bad? So it's pretty complicated. So I just recommend if you're having balance issues to see a podiatrist and, you know, see if there's anything you can do to adjust your feet, because so many people have foot pain and things like that.
Yeah, speaking from experience, I can say that I do, and I'm sure a lot of folks out there have similar issues. So, well, I want to thank you all so much for jumping on today to talk to me about balance, and I thank you for your time, and we'll see you at the next